Hi, welcome to Orthodontics by Dr. Kieran Daly, my YouTube channel. Today we're going to talk about the treatment of overcrowding in a teenage patient with both expansion and extractions, as well as braces. We're going to talk about this patient, Devon, who presented at about 12 years of age. Devon had all of his adult teeth, and you can see from his smile photograph that he had a very narrow and constricted smile or upper arch, as well as significant crowding. You can see on his OPT x-ray that he had no room for the growth or eruption of his upper permanent canine teeth. So we started Devon's treatment with expansion. We used a very specific type of expander called a hybrid expander. This uses two very small temporary implants that are placed about 1 centimeter behind his upper front teeth that acts as an anchor for the expander. This allows us to create a much greater expansion in the upper arch, creating more room for the normal or natural alignment of the upper teeth. So we carried out a whole centimeter of expansion in the upper arch or palate, and at that point we did a reevaluation, and despite all of the additional space that was created, it was felt that there was still completely inadequate room for the upper canine teeth. So a decision was then made to carry out the extractions in both the upper and eventually in the lower arches. We fitted his train track braces initially in the upper arch and eventually on the lower teeth, and it took us about just under 2 years to carry out all of the orthodontic treatment, including the alignment of the teeth, the creation of the correct fit of the teeth and bite, known as the occlusion. And then at the end of his treatment, we removed his braces. Devon had a little wear and tear on the edges of his upper front teeth, so he had some aesthetic dental treatment carried out in the form of non-invasive composite bonding on the edges of his upper front teeth. So when we get to the final smile photographs, you can see that Devon now has fantastic dental aesthetics as well as facial aesthetics. A common misconception relating to the extraction of teeth is that it narrows the patient's smile. But when we put the two photographs together, his pre-treatment and post-treatment smile photographs, you can see that there has been a significant increase in the width of his smile. So despite the fact that Devon had 4 teeth removed, he has a much wider smile after treatment than he did before treatment. So why is this? Well, the correct treatment choices, including the use of a hybrid expander, allows us to create a greater width and volume in the palate and upper arch, and this naturally increases the width of the smile. So despite the removal of the teeth, Devon has ended up with a wider smile.